Hello, I'm Dr. Keisha Ross, and I have the honor of working with my colleague, Dr. Maurice Ensley, on the Race-Based Stress and Empowerment Project. The images that you saw are from all the conflicts. Veterans of color have been active in serving our nation, but are forced to suffer in silence. We are here to share that silence, to hear their voice and the solutions. Folks don't often think of people of color in the military. Veterans of color from World War I and II are finally getting their recognition. But some come back to events such as Isaac Woodard, who was beaten and blinded on his way home while still in his uniform by the police when stopping and asking to go to the restroom. As he was returning home from an honorable discharge. How many Isaac Woodards are at your facility? How many Isaac Woodards are suffering in silence? Imagine that you return home from sacrificing blood, sweat, and tears to return to events such as Ferguson, Missouri, where a young Black teen was gunned down by a police officer. Often, veterans of color do not talk about their race-based stress and trauma experiences. It's time that their voices are heard. It's time that they are understood. Let's hear what they have to say. Veterans of color are concerned with a lack of trust in the system and of providers. They're concerned about prejudice within their treatment and feel there's a lack of transparency. They fear they don't see us as human. Imagine you come home to experience hatred. Imagine you come home to feel alone. Imagine you come home to feel disgust and isolation. Imagine you go to a VA for help and you're told that your race-based stress and trauma experience is not enough to qualify for a PTSD diagnosis. Imagine you're told that it's not enough for a service connection. When veterans try to bring up their experiences of racism, it can be seen sometimes as anti-American sentiment. How do we get from silence to hearing the veteran voices? Our veterans of color, how do we hear their voices?
One answer has been the race-based stress and trauma groups, which were designed to address the impact of discrimination on racial and ethnic minority veterans. In addition, these groups encourage appropriate utilization of VHA healthcare services, as well as serve as a tool to understand the experiences of discrimination among our minority veterans. The RBST groups have several evidence-based principles woven within them. The groups focus on increased self-efficacy in assertive communication and increasing the use of adaptive coping strategies that enhance empowerment and resilience. Overall, we assist veterans in carrying the load thrust upon them by racism. I want you to, again, imagine yourself as a veteran of color. What would it feel like if instead you came to the VA feeling connected? You saw providers that looked like you felt validated in your concerns, and you were treated with empathy. Imagine your visits are now filled with community, dignity, trust, respect, and you feel represented. You've seen your view of the VA change, and you see their anti-racist efforts, which afford you a sense of safety within the facility's walls. Imagine having the racist assault you experienced in the military recognized and support provided. Knowing your concerns matter. Now imagine as well if Isaac had this experience. He would likely feel empowered. Imagine feeling for the first time since your service that you have hope for more years to come, or you're comfortable in your own skin. Let's hear it from actual veterans about their experience with the RBST groups.
The impact that the program has had on me has, again, helped me to identify the issues, has given me very good coping skills to be able to deal with those issues.
This program is very good. I should have had this program probably 20, 30 years ago. It would help me be able to face tomorrow, face, what's going on right now.
As you just heard, veterans should not have to wait for this needed care. Currently, we have at least 40 active mental health providers and monthly consultation calls. Groups have been offered at approximately 35 VA sites. Since June of 2020, we have fulfilled 115 requests for support and served hundreds of veterans of color. We are just getting started. Join us in this journey. As one of our veterans remarked, this should be available at all VAs. This to ensure that we are serving all who served and make sure we end the silencing of the Isaacs at your facility. Join us on the journey to end the silence. We need support for maintaining and growing the RBSTE program. An Office of Mental Health and Suicide Prevention level position for addressing race-based stress and trauma would be ideal. Enhanced support for outreach is essential to assisting our most vulnerable veterans. Service connection for enduring severe acts of racism will go a long way to address the silence. If you need to reach us for training, consultation, or starting a group, please contact us at keisha.ross@va.gov and maurice.ensley@va.gov. And special thanks to the consultants who have been essential to this journey. Thank you.